This is Peter J. Pollack, MD, with another Medical Practice Trends podcast, and our guest today is Mary Pat Whaley, a practice management consultant who blogs on managemypractice.com. Welcome, Mary Pat.
Thanks. Thanks for having me back again.
Sure. Well, our topic today is scanning charts into an EMR, questions to guide your action plan for conversion. Although we would like to think that as soon as we flip the switch on an EMR system and go paperless, that's not actually a reality, correct?
Right. There's a lot of preparation work, and the least of which is not actually moving your patient information into the EMR. And you can do that in a couple of different ways. There's no real best practice. It really depends on what kind of practice, how large a practice, and what resources you have at your disposal as to how you're going to set up an action plan for scanning charts.
By action plan, you mean that before practices start winging it, they really need to sort of draw out or storyboard exactly how they're going to do it to make the best use of their manpower.
Exactly. And to decide if they're going to need some additional manpower, I advise people to, first of all, think about the kind of patient visits that they have. Do they have patients who they see for years and years, maybe a couple times a year, maybe more? Or are they at the other end of the spectrum where they might see a patient a couple times and then maybe not again for 10 years or maybe not again ever? So those two extremes need to be addressed in very different ways.
When you were mentioning the issue about maybe having additional employees for scanning charts, that there may be some tests or parts of a chart that are actually scanned in, and you might be able to have temporary workers or less skilled clerical workers scan the information in, but once it's scanned in, you may need someone with a slightly higher skill level to decide exactly where those documents are going to go.
Yes, and what you're talking about is the separation of the two parts that we sort of group under scanning, and one is scanning and the other is called indexing, which means, as you mentioned, actually placing the documents in the appropriate part of the EMR, just like now you would file an X-ray report that comes back into the appropriate little tab under the paper chart. So the first thing that people think about is my current medical records staff. How will they transition into the future with us? And in some cases, that will be the person who will be responsible for managing the electronic functions of the EMR. There is going to be ongoing scanning or indexing from medical records that come in either by electronic fax or by mail. But a lot of the initial scanning before you go live on the EMR can be handled by temporary staff. And if you are lucky enough to be going live or be doing your pre-scanning during the summer, high school students and college students are very savvy, and that's a great opportunity for you to snag some pretty reasonably priced help.
What do you advise practices as far as how much of a chart they need to scan in, and when do they need to consider using an outsourcing firm to actually hand the charts over and scan everything, basically?
Some practices want to pretty much get rid of their paper charts altogether, and whether they're going to put everything in the EMR or if they're actually going to offload records that they don't want to put in the EMR, but neither do they want to pay to have them stored, they will usually put them in a repository where it's easy to go find something if you're looking for it. And trying to decide what portion of the patient chart of your current patients is actually going to go in the EMR is one of the biggest decisions you're going to make. I can't tell you where I heard this statistic, but I have heard this several places that you only use 25% of the records that you scan into your EMR before you go live. So that's pretty interesting. However, which 25% it is, we don't know.
That's a good point. In the case of our practice, since we had some physicians who were a little less comfortable with cutting the umbilical cord with the paper chart, when we transitioned to EMR, we actually had the chart pulled and in front of the doctor. And then since everyone kind of had their own comfort zone with cutting the paper chart loose, we would have a stamp for each doctor. So for instance, in my particular specialty, if I was seeing a patient and was pretty comfortable with the patient, I would have them stamp the paper chart, don't pull paper chart for Dr. Pollack. Now, maybe one of my other partners who deals with a problem that's a little more critical, they may need the paper chart a little bit longer. That way, gradually, we kind of do away with the paper records, but each in his or her own time.
That's a great way to do it. I think that's very helpful to the physicians who are feeling a little panicky about it. Not everybody is quite as generous as your group was because, of course, it takes additional staff to continue to pull and file the charts and to also make sure how you know that the physician has decided that he's not going to have the chart anymore. How that message, without actually having somebody physically pull the chart to see the stamp, I would think would be another workflow that you'd be trying to minimize that staff time.
Another possible tool is to have sort of a router, a sheet on the front where someone can specifically say, if it's your own patient and no one else really follows them, you can say, I want the last X number of these exams, the last X number of these tests, the problem list sheet, the medication sheet, and then stamp it. And then you get exactly what you need. And if they have the same test every year and it's normal, then why scan the whole chart?
Yeah, I think that the decision about what you're actually going to put in the EMR is probably one of the biggest decisions that groups have to make. It's really kind of a roundtable discussion that everybody needs to take part in from the standpoint of thinking through how it will actually work and deciding how it's going to be comfortable for each physician and how it is going to be as efficient as possible.
Mary Pat, if someone wanted to reach you or contact you or find out more about what you do, how could they do that?
Certainly visit my blog at managemypractice.com or email me at marypat@managemypractice.com. And my phone number is also listed on the blog if you'd like to call me.
Well, thanks so much.
Thank you.